So next up is Dr. Betsy Rono. So pleased to have you here. She's a lecturer at the College of Health Sciences, a PhD candidate at Jomo Kenyatta University of Agriculture and Technology. So quite excited to have her presenting, and I'll turn it over to you.
Thank you very much. We are a team from Jomo Kenyatta. Let me just ask my colleagues to wave so that. Thank you very much. And just to give just a little bit of an overview is what we or what I'm presenting is a product of our student mentorship. We run a J-Hub, and this is where we have students mentored. That's why you're seeing a whole list of students who are under our mentorship. So we put them into groups and give them case scenarios, medical case scenarios, and ask them to develop an innovation. So what I'm giving is an innovation under the Digital Transformation Project in Kenya under the Ministry of Health. And this comes under the Boma Mtaani. I'm giving you it in Kiswahili. Boma in Kiswahili is the home. So it's a Boma Health Mtaani. You have the health right with you in the home, in the village. So we are pleased to present what our students did. And this was a work they did in 5 working days. So we were amazed how the young people can really come up with an innovation quite fast. And you just give them the scenario, you mentor them, and you are so. This is what we managed to. So we are presenting one of the innovation that has been done by our students, and we are very proud. They are not able to be here because of travel challenges. So what we do is we have teams. The students select their own teams and they sit and run the product on their own. And we keep having boot camps where we meet them on daily basis or whatever time that they are available as so as mentors. We do it on voluntary because we want to have solutions for the Ministry of Health. So this is done in collaboration with the Ministry of Health, and they really support us to ensure that this is done. So we this was one of the innovation, Patient Care Link, and it is GIS-enabled, seamless referral communication model. Right from the community, whereby in Kenya, we just launched, our president last year launched the community health promoters. So we have 115,000 in every community unit where they man. And as a result of that, this comes in now under the primary healthcare focus, which we are now focusing in Kenya. So just to give an overview, is the Patient Care Link. Basically, we are looking at advancing the healthcare and ensuring that the patient who needs care can receive this care so that we avoid the delays that bring in, gives the patient or reduce the time in terms of the costs, and ensure that we have an overall efficiency of healthcare providers, and they're able to reduce the chance of the patient developing complications or the patient reducing the adverse events as a result of the disease process. So the Patient Care Link innovation is already linked to 4,800 health facilities in Kenya. In Kenya, we have close to 17,000 health facilities. That is both public and private health facilities that are coming in. So we foresee that this innovation is going to really come in, and it's giving a very good landscape. And this is giving a testimony of how the young people have innovative minds that can really be transformed to improve the healthcare in our country. So this gave the background why we gave them this case scenario, because we have advanced, we had adverse events normally that arise out of any health process, and we wanted to see, can an innovation be done or be formulated. So our student used the Open MRS 3X platform whereby there's a link right from the community to the health facility and back to the community, whereby they're handed over back to the community health promoter. So the innovation relies on messaging, the short message, because not everybody can afford the Android phone. So it's linked to the SMS. So everybody, even with a simple phone, can be able to get this information. So this is what gave in the background. So this is the key features of the CareLink. It's a user-friendly, and because we're using the SMS or the SMS, then there's a faster communication. One doesn't have to rely on the internet. So it's direct. Secures the real messaging interface. So within the platform, and therefore ability for one to provide highlight in terms of the client issues, and then so that they're able to link up. So I believe you can see that on my left is we have the doctor linked, and then we also have the patient at the far end, and then the information communication between them and the person referring and to the next one. So it's a seamless communication for point of care in terms of managing the clients and integration with the digital health application for efficient provider communication. So this is integrated with the patient records, and it's a customizable notification system. The key features is that it also allows file attachment in case of the lab investigations, any history about the patient. So it allows that. It has the message history search, user roles. There's also audit trail for accountability, mobile accessibility to enhance responsiveness and flexibility. And then it's integrated with other systems within the health system. One of it is the queuing system. We also have the health education, which is key in the primary healthcare component. So this is how the innovation works. It's a real-time communication process, and therefore it's a continuous, and we're able to monitor the patient in terms of the messages and the referral, where the patient is being referred, and any problems, we are able to monitor that. It's a real-time communication between the patients as well as the healthcare providers, and facilitated by the integrated messaging system within the Open MRS 3.0 platform. So the messages are composed, they are sent and then received in real time, allowing for timely collaboration and decision making in terms of patient care. There's also priority marking, and the messages are prioritized, and we have the red, the yellow, and the green in terms of priority. So if you receive a message and it's red, then you need to know this is a patient that needs to be prioritized and given all the urgent attention that they need. So all the parties are informed in the status of the communication. So this is a product overview. For you to access this service, you must be registered just because of the data protection. Which we have the data protection policy in Kenya. The government is very particular and keen on that. So it's only accessible to all the health workers who are registered to be able to access. It's also easy to log in. Once you log in and you have the username, then you have the password and you're able to use the CareLink. It also provides a friendly interface and allows healthcare provider customization to their preference. So you can either use the ID or the phone number or email or what you're comfortable with, just to fit in to the customer or the patient right in the village, in the community. It also allows search for healthcare providers within the healthcare system, and also the healthcare sisters through centers through filtering. So you can filter and be able to access. We have the link in terms of the healthcare providers and also where they are based. So you have the doctors, you also have the service providers. If you want a private hospital, you want a public hospital, you want an NGO based, and then you choose as the. So simple messaging is the reason behind this, just to access the common one, or we call them Wanjiku in Kenya, referring, that's the name we use to refer to every Kenyan, so that they're able to access. That's how the simple messaging is. You're able to have, and then it's prioritized. The message is prioritized. So as soon as you receive the message, the color coding changes depending on the priority. So it also allows the healthcare to be able to view the history of how, the patient, where they've been, how they've been treated. So this also which doctor has seen the patient and when. So you have an overview of that. And then we also have the reports, which you can upload and also generate a report from the CareLink app. It's GIS enabled because of so that we are able, in terms of generating the reports, would want to really know the patients are coming from each area and how who saw them and how was it. The GIS also enables route optimization in terms of which is the shortest route in terms of getting to the health facility, so that we're able to reduce the time travel and improve in terms of logistical efficiency. Priority messaging will enable one to mark the messages as the high, medium, or normal priority, and that's where we used the color coding, so that even if you don't have to read the message, you can see the color coding, and it enables the priority. So this also provides capability so that one is linked to other healthcare applications in terms of the queuing, as well as the health education system in terms of healthcare promotion. This app, or this innovation, is able to generate reports so that for the policymakers to now be able to make a decision on which area or where is the innovation or intervention should be given more priority. So the report is linked to the Ministry of Health, and that will give us a good. So in conclusion is already it's a plus, because we are already connected to 4,800 healthcare facilities in Kenya, and we are waiting the rest also to give us the Ministry of Health, because we are working through the Ministry of Health. So we load the health facilities through the Ministry of Health because of the collective action and the success in terms of the buy-in. So the next steps would wish to do is now to do the user testing and come up with surveys on which pain points and optimize the user experience as we continue loading. So there are of course the risks and successes that we anticipated, but we are ready in terms of doing the dry running and to keep improving on this work for our students. So we are very happy to be here. Thank you very much.
Okay. I like your enthusiasm for questions.
Well, congratulations. Excellent presentation, and very interesting the collaboration between academia, the students, and the Ministry of Health. That is very important. Just when you're looking about risks or potential problems, what we face in our health system, but I've seen in others, as complex system with their entropy, they resist changes. So perhaps the healthcare work, they usually have some rejected demand, the people making long queues for getting an appointment, for example. And when we started with this type of technologies, now I have a lot of more patients to see, so we don't like, so many, for example, physicians were making a boycott to these new applications because it was evident that they weren't giving the answer that people were expecting. So that might be a possibility. Hope not that it happened to us.
Yes. Thank you.
Interesting reflection. Other questions? Yeah.
Hi. Thank you for this really interesting project that you're sharing with us. One of the most difficult things a sick person faces is like, do I need to see a doctor? Is this just going to go away with some aspirin, or is this something where I need to make an appointment? And so we have call-in nurses consultant that you just call and they ask you a few questions, and at the end mostly they say you need to go to the ER, but sometimes they say like just take some aspirin. Is that sort of what you're aiming for, or are you trying to actually have the doctors do a diagnosis and make a prescription based on this exchange?
Thank you. The scenario in Kenya is the care-seeking behavior is they delay until they are very sick. So you end up, a patient dies who really didn't deserve to die. So you can avert that death. So we want to really, that's why we are calling it Boma Mtaani, so that we are able to really get to the patient early to avoid complications, to avoid the adverse event. So maybe just to give you a little bit is we have diverse interventions that they do. One is they will consult among themselves, and then that is day one. Maybe day two, they say, I think I slept well. Then day three, they it looks like the pain is back again. So they go now to the next, maybe they go to what do you think? Should I go? They say, no, just go tomorrow. Just keep observing. So in the process, the disease is, the complications are setting in. So this is the interface we wanted to see, because what we can do to ensure that we reduce the adverse events among the patients. And then secondly is the Ministry of Health or the Kenya government has been trying to enforce the referral system to ensure that you really need to be seen by a consultant. Can this problem be sorted right within the dispensaries, or you don't really, so that we really ensure that the person who needs to be referred to be seen by a consultant gets the consultant. So they are sort of a dual system that we are trying to see, and that's why the Ministry of Health was really excited, and that's why they gave a go-ahead so that we start linking the health facilities already. So those are the different scenarios that happen in Kenya.
Great. Thank you very much. For time reasons, I'm going to cut this off, but I really appreciate you.
Okay. Thank
Thank
you.
you so much for sharing. Yes. Round of applause.